Hi, my name is Karen Manuel, and I'm going to be speaking to you today about atrial fibrillation. Here's a short video explaining atrial fibrillation and how the blood is pumped through the heart and what happens to the blood when atrial fibrillation occurs.
Your heart is a muscle that pumps blood around your body. It's made up of 4 chambers, 2 at the top called the atria, and 2 at the bottom called the ventricles. Your sinus node sends out electrical impulses. Atrial fibrillation, or AF for short, is when other areas of the atria send out electrical impulses too. These irregular impulses cause the atria to twitch. When this happens, blood isn't pumped out effectively, which could cause a blood clot to form. If this clot travels to your brain, it can lead to a stroke. When your heart isn't pumping blood properly, it can lead to symptoms such as tiredness, dizziness, or feeling faint, shortness of breath, or palpitations. How AF affects you will determine the treatment you need.
During atrial fibrillation, the atria, or the upper 2 chambers of the heart, are out of coordination with the ventricles, which are the lower 2 chambers of the heart. The major concern with atrial fibrillation is the formation of a clot that could travel to the brain and cause a stroke. Conditions that contribute to atrial fibrillation are hypertension, or high blood pressure, myocardial infarction, or heart attack, coronary artery disease, abnormal heart valves, overactive thyroid gland or metabolic imbalance, exposures to stimulants such as medications, tobacco, caffeine, and alcohol, sick sinus syndrome, which is an improper functioning of the heart's natural pacemaker, lung diseases, previous heart surgery, viral infections, stress due to surgery, pneumonia, or other illnesses, and sleep apnea. People who are predisposed to atrial fibrillation are Caucasian, obese, have a history of hypertension, and are male. Atrial fibrillation is diagnosed several ways, but the primary tool for diagnosing atrial fibrillation is with an electrocardiogram or an ECG. This is when electrodes are attached to the chest and they sense the electrical signals of the heart. A Holter monitor is similar. They use a portable ECG that is worn and records the heart's activity for 24 hours or longer. An event recorder is a portable ECG that is worn for several weeks. When the person is experiencing a fast heart rate or any other signs or symptoms of AFib, they push the button to record the electrical activity of the heart. This shows the heart rhythm at the time of the symptoms. An echocardiogram is a test that uses sound waves to create moving pictures of the heart. This is a non-invasive test. Blood tests are used to rule out other conditions that might be causing atrial fibrillation, such as thyroid problems or substances that are in the blood. A stress test. This test involves a running test while the ECG is in place. And then a chest x-ray, which is done to have images of the heart and lungs to determine if other conditions may be contributing to the signs and symptoms of atrial fibrillation. Treatment of atrial fibrillation. There are several treatments. One of the treatments is cardioversion or electrical shock that restores the heart to its normal rhythm, or the use of drugs to restore the heart to its normal rhythm. There are other medical procedures as well. One is called a catheter ablation, which is where a tube is inserted into the blood vessels and threaded to the heart, and then radio frequency energy is used to destroy the tissue that is causing the AFib. The maze procedure is similar to this, although it requires open heart surgery, and a pattern of scar tissue is created to interfere with the electrical impulses that are causing the AFib. The Watchman, which is a minimally invasive procedure, is actually used to reduce the risk of strokes escaping from the heart. It does not actually treat AFib. With atrial fibrillation, the main concern is to prevent blood clots from forming. Doctors will also treat underlying conditions that may be causing the atrial fibrillation. The lifetime risk for developing atrial fibrillation, or AF, is 1 in 4 when older than 40 years old. If one parent has a history of AF, then the odds increase more. If both parents have a history of AF, then the odds of atrial fibrillation increases even more so. In recent genetic studies of atrial fibrillation, it is suggested that up to 30% of people who have atrial fibrillation may have a relative with the same condition. Atrial fibrillation is a complex disease. Many variations to the genes offer modest contributions to the risk of developing the disease. This disease follows the common disease common variant hypothesis, which means that the common variants or changes to the genes are responsible for the majority of the heritability of the disease. There is continuing research in the field of genetics and of atrial fibrillation. The hope is that one day genetic testing may be possible in order to determine one's risk factor for developing AFib and plans to prevent the disease from occurring or to manage once the disease has manifested itself. Atrial fibrillation is not determined by genetics alone. There are ways to prevent AFib from manifesting itself. One can eat a heart-healthy diet, increase physical activity, avoid smoking, maintain a healthy weight, limit or avoid caffeine and alcohol, reduce stress, as stress can cause heart rhythm problems, and use caution when using over-the-counter medications, as some have stimulants that can cause a rapid heart rate. As you can see, atrial fibrillation is a disease determined by genetic factors and one's lifestyle. You may not be able to prevent AFib from occurring, but following the suggested lifestyle may postpone the disease from occurring.